everyone, welcome to Superpoints. Today let us do some MCQs from preventive and social medicine, especially disaster management. So disaster management has public health significance, as we are going to see, and there are some important questions from this section. So before we do the MCQs, I would like to go through most important points from this section. Please download the exercise file and you can practice as we do these MCQs one by one. First of all, let us see what is disaster. Before we talk about disaster, you should know what is disaster. A disaster is a serious disruption of the functioning of a community or society, causing widespread human, material, economic, environmental losses that exceed the ability of the affected community to cope using its own resources. So it should exceed the ability of the affected community. So it has to be so much. So one community's disaster may not be disaster for another community. For example, a big city and there is a helicopter crash, 4 people dead. That's not a disaster because they can cope. They have resources to deal with the helicopter crash in that community, right? It's a big city. But let us say it's a small town and the helicopter fell in the middle of the village and people have no idea what was going on there. They don't have resources to deal with a helicopter crash in the middle of a few families in that small village. So anytime you see that inability or to cope with its own resources, we call it a disaster. A hazard. What is a hazard? A hazard, a potentially damaging event, phenomenon, substance or human activity capable of causing injury, death, property damage or environmental degradation. So classification of disasters. When they give you a disaster, what kind of disaster is that? We have geophysical disasters like earthquakes, volcanoes and tsunamis. We have hydrological disasters like floods, flash floods, landslides, avalanches. And then there is meteorological disasters like cyclones, storm surges, tornadoes, thunderstorms, heat waves, cold waves. Then there are climatological disasters like droughts, forest fires, extreme temperatures. Then there are biological disasters like epidemics, pandemics, insect infestations. Then there are human-induced disasters like Bhopal gas tragedy 1984, and there is Chernobyl in 1986. And there are terrorism, wars, oil spills, building collapse, fires. Then there are CBRN hazards. These are chemical, biological, radiological, nuclear disasters. Now, what are the health effects of these disasters? First of all, people die. That is mortality, right? So we have immediate deaths from a trauma. Deaths may exceed injuries like in floods, landslides, avalanches, tsunamis. So if there is a landslide, a lot of people get killed. Right? Not many people escape that with injuries. Then if there is like a big plane, like a Boeing, crashing, like we saw when the plane from Ahmedabad to London fell in Ahmedabad, right? Hundreds of people were killed and only one survived. You see, hundreds were killed and only one survived. So deaths exceeded injuries. So in some incidents, like for example, landslides, avalanches, plane crashes, deaths far exceed than injuries. So then we have morbidity. In morbidity, you get four categories: injuries, emotional stress, epidemics, and endemic diseases. And there are nutritional effects: food shortage, malnutrition, vitamin A deficiency, gerophthalmia. Disaster management definition is systemic process of using administrative decisions, organization, operational skills, and capacities to implement policies and strategies for reducing disaster impact. Three pillars of disaster management. All right, three pillars. What are the three pillars? Number one, disaster mitigation. Measures taken before a disaster to reduce its impact and vulnerability. Flood control projects, earthquake resistant buildings, land use planning, cyclone shelters. All right. So, for example, you see like a city in Japan that builds like a nice wall around a nuclear power plant. That is a mitigation. If there is a big tsunami, that wall may be destroyed, like we saw in Fukushima nuclear plant, and people get killed. But at least you are trying to mitigate it. For example, if you try to build a dam up the river, that's a mitigation to protect the city. All right. So cyclone shelters, tsunami shelters, tsunami warning systems. So these are disaster mitigation efforts. So you reduce the vulnerability basically. And there is disaster preparedness, activities undertaken before a disaster to ensure effective response. All right, you strengthen the systems, improve readiness, build response capacity. Like for example, chief minister comes before the cyclone approaching, and he calls the districts, police officers, every officer is there because they want to be ready. When the flood comes, they want boats, they want food and medical supplies, everything ready to go. So that is this preparedness for the catastrophe going to happen. So you need risk assessment, early warning systems, public education, mock drills, emergency planning. So readiness before disaster is preparedness. Then there is a disaster response. This is immediate actions taken during and after disaster. All right. So who are the first responders? The first responders are the people who are not impacted by that incident, by that disaster. For example, in earthquake, people got injured, but some people got very few injuries. So these people can be part of these immediate actions. So they do the search and rescue, first aid, triage, relief operations, and medical care. So the response is to save lives. I mean, everything is to save lives, but response is to save lives after the disaster. And then there is disaster cycle. You should know what are the steps in disaster cycle: mitigation and preparedness, impact, response, rehabilitation, reconstruction. All right. MPI, triple R. Okay. MPI and triple R. Remember those this mnemonic because you will need it in your examination. Mass casualty management. You see there are components like search and rescue, first aid, triage, stabilization, hospital treatment, distribution of casualties. Most immediate assistance come from uninjured survivors. Okay, they take the first step. Then the triage is rapid sorting of casualties according to severity and survival probability. The aim is greatest good for the greatest number. It's utilitarian. It's like it's not like first come first served. Okay, it's more like who got injured and who needs immediate help. For example, if somebody got an abrasion, keep him there. Somebody got a fracture, but it is stable. Somebody had a shoulder dislocation, keep him waiting. But somebody is having shortness of breath, attend him first. Somebody got a femoral fracture, attend him first. Somebody got chest pain, attend him first. This guy with shoulder dislocation can wait. All right? That is triage. So in triage, color coding is important. Okay, remember this. The red is immediate treatment. They are highest priority. For example, somebody lost 2 liters of blood. That's the highest priority. Somebody is having a severe shortness of breath. That is highest priority. All right. Delayed treatment. Yellow is for medium priority. They can wait. I mean, they are not completely normal, but they are not completely dangerous. Okay. Delayed treatment. You tell them, well, I will come to you. Don't worry. Please have a seat. Like, for example, shoulder dislocation guy. You can tell him to wait. All right. That is yellow zone. And then there is a green zone. These are minor injuries and they are walking wounded. For example, let us say somebody got a finger fracture. That's a minor injury. Go home, talk to your family doctor about it. They can walk. All right. So green is go. Green is go. So that is minor injuries. Black is for dead. All right. Dead or moribund. These are like non-recoverable. Like for example, somebody is got a severe head injury, and you see that they are not going to be recovered from that situation. Then that's moribund. All right, that's a black. So red, green, yellow, green, and black. So those are the 4 colors from triage. Then the management of dead bodies, recovery, transfer, identification, support to relatives. Dead bodies rarely cause epidemics unless water sources become contaminated. So when you see dead bodies, don't get freaked out on the exam. Don't connect them to epidemics, because unless the water is contaminated, they are not going to cause any epidemics. Relief phase begins when external assistance reaches the disaster area. So relief phase begins when the external assistance reaches. Humanitarian supply management, there are 4 components: acquisition, transportation, storage, distribution. Disease control after disasters. So after the disaster, you need to focus on disease control. Common causes: overcrowding, poor sanitation, contaminated water, displacement, vector breeding. Common diseases after disaster: most common is gastroenteritis. All right, because there is poor fatigue, most likely the food sources are contaminated, the water sources are contaminated. That's why people are more vulnerable to gastroenteritis. Then there is respiratory infections, like because people are overcrowded, they're more likely to get infections from each other. So they have acute respiratory infections. Sometimes there are zoonotic diseases, like for example, if there is a flood, people may have leptospirosis. Then vaccination after disasters, like when you see vaccination, the temptation is to vaccinate. No, but in this exam, vaccination is not recommended. The routine mass cholera vaccination or typhoid vaccination are not recommended. And the idea is, what is recommended is maintain routine immunizations, services, appropriate tetanus prophylaxis. So mass tetanus vaccination is unnecessary. Water supply, chlorinate. Why? To prevent microbial contamination. Sanitation measures, take sanitation measures. Earthquake safety. falling objects, collapsing objects cause most of the injuries. If you are indoors, stay inside and move toward the center of the building. Avoid windows, avoid elevators. Do not stand below staircases. All right. Flood safety: during flood, switch off electricity, move to higher ground, avoid contaminated water. All right. Switch off electricity if there is a flood. That's important to remember to prevent electrocution. Next, toxic gas exposure: close doors, windows, seal cracks. So, Disaster Management Act was passed in 2005, and the apex body is the National Disaster Management Authority (NMDA). Chairperson, Prime Minister of India, Mr. Modi is the chairperson now. Then there is nodal ministry, Ministry of Home Affairs. That's important. Health sector agency is Emergency Medical Relief Wing under DGHS. Now, with that backdrop, let us do some MCQs on this section. Number one, according to UNISDR, a disaster is best defined as. What is a disaster? Whenever there is a serious disruption causing coping capacity, beyond coping capacity. Okay, that's important. For example, B is within coping capacity. No, that is incorrect answer. It has to be beyond coping capacity. A hazard. What is a hazard? All right. A hazard is a dangerous phenomenon that may cause loss of life or damage. That is important. Okay. For example, if it's a dangerous phenomenon but there is no destruction of property, that's not a hazard. Okay. You may say, oh, I saw lightning and I was so scared. Well, that is not a hazard. If nobody is dead, no property is damaged, that's not a hazard. But if somebody got killed, that's a hazard. All right? So a dangerous phenomenon plus loss of life or damage, that's a hazard. Which of the following is a geophysical hazard? A geophysical hazard here is earthquake. All right. Earthquakes, volcanoes, tsunamis, those are geophysical hazards. A drought is only is a climatological. All right. An epidemic is a biological hazard. A cyclone is a meteorological hazard. A meteorological hazard. Okay. Which of the following is a hydrological hazard? Hydro means water, so it's flood. All right. A is the correct answer. Cyclone, storm surge, and tornado are classified as. All right. Cyclone is like a meteorological hazard. All right. Storm surges, tornadoes are meteorological hazard. A drought, you would say climatological hazard. A drought. Epidemics and insect infestations are examples. So epidemics and insect, these are easy to remember, right? They're biological hazards. CBRN stands for, what does CBRN? It is A, chemical, biological, radiological, and a nuclear. Okay, remember that. They will confuse you with different sets of acronyms. So you need to know those words: chemical, biological, radiological, nuclear. Which of the following is a human-induced disaster? A human-induced disaster is industrial accident. That's important. That's a human-induced. Remaining are like natural disaster. In earthquakes, the number of injuries usually exceeds deaths. All right. Most people get injured, and also if the earthquake happens during the night time, most likely there will be more casualties because people are sleeping. All right. Because of that, nighttime earthquakes are more dangerous to human life than daytime earthquakes. And be that as it may, injuries usually exceed deaths. Okay, in which disaster does death frequently exceed injuries? Deaths are more in landslides. Landslides, like for example, if you are returning from Kashmir and there is a huge flood and a big landslide came, and it will cover many highways, and people are stuck below the mud, and most of them unfortunately die. All right, death frequently exceed injuries. The four major categories of disaster related morbidity. So what happens after disaster? There are injuries, and there is invisible pain, emotional stress is there. There is epidemic disease, that is also correct. The D, cancer, is incorrect. The fourth one is endemic diseases like gastroenteritis. All right. Three fundamental aspects of disaster management are response, preparedness, and mitigation. All right, that is the correct answer. Mitigation. The first help after a disaster usually comes from. First help comes from uninjured survivors. All right, that is correct answer. Is C. Disaster triage means rapid classification of injured persons on the basis of severity of their injuries. All right, that is the correct answer. The principle of first come first treated. No, it's not about dead bodies. It's not giving highest priority to moribund patients. All right, we give highest priority to those who are salvageable and who are seriously injured. All right. So rapid classification of injured persons, that is triage. Objective of disaster triage is to A, maximum benefit to the greatest number of injured persons. In disaster triage, red color is highest priority. All right, that is for. In disaster triage, yellow color is about medium priority. In disaster triage, green means go, right? That is ambulatory patients. Yeah. And number 20, in disaster triage, black color indicates dead or moribund patients. D. Disaster triage, after a disaster, triage should preferably be carried out. So, at the disaster site, you need to do the triage right there at the disaster site. Which of the following is usually included on disaster casualty tags? So, disaster casualty tags, you need name, age, place of origin, triage category, and initial treatment. So, the answer is A. Dead bodies after disasters usually pose minimal epidemic risk unless water is contaminated. So, correct answer is C. Relief phase in disaster management begins when? So, relief phase begins when outside assistance reaches the disaster area. That is A. Components of humanitarian supply management include components of that is A. Acquisition, transportation, storage, and distribution. 26. The most commonly reported disease in the post-disaster period, that would be gastroenteritis. B. Which respiratory condition commonly increases after disasters? It is acute respiratory infections. A. Which zoonotic disease is reported after floods? After floods, leptospirosis. A. Which of the following recommendations regarding vaccination after disasters is correct? So, WHO recommends routine mass vaccination. No, that is not correct. Mass tetanus vaccination. No, that is not correct. Cholera vaccination. That is not correct. In previously unimmunized injured patients, tetanus toxoid should be given at the discretion of a physician. All right, this is directly from Parks, so that is correct. Following a natural disaster, which of the following vaccination strategies is not routinely recommended? Not routinely recommended. Mass cholera vaccination? No. Maintenance of routine immunization services. Tetanus prophylaxis for appropriate routine cases. So this is correct. This is correct. This is correct. So this is the one we are saying. This is the correct answer for that because it's not routinely recommended. Next, best strategy for tetanus prevention after disasters is mass vaccination? No. High volume immunization coverage? What about C? Antibiotics? No. Isolation of injured persons and tetanus immunization? No. You don't have to isolate. So the correct answer is high routine immunization coverage and proper wound care. First priority in ensuring emergency water quality as part of disaster management is emergency water quality after a disaster, you should chlorinate. So chlorination is the correct answer. After a disaster, the main public safety concern of emergency water quality is A, microbial contamination. Major cause of foodborne diseases after disasters is why foodborne diseases are a big problem after disasters because of poor hygiene. So correct answer is C. In most cases, disaster mitigation measures are intended to mitigation, all right. You want to reduce the vulnerability of the system. So correct answer is D. Primary objective of disaster mitigation is to mitigation itself says you want to reduce, okay. So the reduce the vulnerability of communities and systems and hazards. So correct answer is B. Next, disaster preparedness mainly aims to you want to prepare, all right. So what are you going to do? C, strengthen systems, procedures and resources before disaster occur. C, during a flood, I told you during the flood what should you do? You should turn off the electricity. So the correct answer is D. Most earthquake injuries are due to most earthquake, it is falling objects and collapsing buildings. So correct answer is B. During an earthquake, indoor persons should do what should they? They should stay inside and they should move toward the central part of the building. So correct answer is C. The gas involved in the Bhopal gas tragedy, all right, so that happened back in 1984. Probably you were not even born. But when I was a boy, and I remember my dad telling that incident, in which thousands and thousands of people were brutally killed by this negligence, criminal negligence of Bhopal gas company, and the gas involved was methyl isocyanides, all right, and none of them were brought to justice, and that's a shame, folks. So Bhopal gas tragedy occurred in 1984. B, Chernobyl nuclear disaster occurred in 1986. B, the lead agency responsible for preparation of disaster management plans in India. So it is NDMA. Don't get confused with NDMI. Okay, it's NDMA. So C is the correct answer. Overall coordination of disaster management is in India rests with Ministry of Home Affairs. Okay, that's line. Do not get confused with health, external affairs, those things. It is Home Affairs. Health-related disasters activities in India are coordinated. So health related, it's emergency medical wing under DGHS. Okay, that's important. Don't get confused with the emergency medical wing under NACO. That's not the right answer. ICMR, no. IMD, no. A is the right answer. Indian Meteorological Department plays a key role in warning against, well, it's very easy. cyclone, because that is the meteorological hazard. So if you know cyclone is a meteorological hazard, it's easy to connect these two. Meteorological department plays a key role in warning against meteorological hazards, in this case a cyclone. All right, folks, I hope you got something out of this very important chapter, because we have so many disasters happening. India is among one of the top countries for disasters, unfortunately, and the doctors and others play a very key role in disaster management. That's why you need to know all these things and be prepared for these unfortunate events. Visit our website Superpoints.ai, where you can practice literally thousands of questions as you prepare for your NEET and USMLE. And I see you in the next episode. Thank you.